Okay. So we're planning for reopening, and what do we know so far? We know how many children and by age will be returning and when. Hopefully we know the number of staff that you will need and which staff are available to work and starting when. So those are two key pieces. Now we need to look at the financials. What will this cost us? How do we relook at our budget? It's going to be a little different because there are certainly some additional things we have to consider. And the other important thing is, what are your numbers? Prior to this, did you have a good sense of how much it was costing you to actually provide care per child? Do you have a good sense of what your overall costs were prior and what your overall revenue was prior? Next page. So there are four costs that we want to look at today. First is staff costs, facility costs, services vendors, and then new costs. Next slide. So under staff costs, we have your typical staff cost, salaries, health benefits, and other fringe. And there may be some additional things that you would have in your center that might fall under staff costs, but these are the three basic ones that we all have to provide resources for. So now that you know how many staff you need, you can also look at what that's going to cost you. I just want to add, while we're talking about financials though, that the PPP, the program that falls under the SBA federal funding, is still open for people to apply. I know here in Essex, we had about 49 providers participate in that initiative that we had, and I would encourage some of you who have not looked at that as a viable source of income, that you can still look at it. The other thing is that there are grants that are available. Yesterday, Assistant Commissioner Natasha Johnson talked about FEMA grants. That information is going to be also posted when we finish. There are also individual grants that various municipalities are offering, as well as the New Jersey Pandemic Relief, and all that information is going to be available to you afterwards. But we also need to look at where do you get additional funding from to support your operation. Okay, next slide. Of course, you're very familiar with facility costs, mortgage or rent, utilities and repairs, and there may be some additional things that fall under facility as well. We want to encourage you, if you have not done so already and you think it would be appropriate, to contact your mortgage company and see whether your mortgage could be deferred or interest-only payments. Also contact your landlords to see whether rent can be deferred. There are other programs out there that you might be able to take advantage of to cover your facility costs. But facility costs, for the most part, will probably stay consistent with what you were paying prior to March 1st. Next slide. Service vendors, and these are your food vendors, landscaping, exterminator, nurses, and there may be many other services that you contract out. You need to look at those services. Will they remain the same? Will they increase? Can you decrease some of those services? Can you defer payments? So these are the things that you need to look at in terms of your budget. Next, please. And then the new costs. First on our new cost list is PPEs. We know we must have masks, we must have gloves, and there are other things that are recommended as well. You know you have to do health screenings every day and take temperatures of all the children and the staff. You know you have to enhance your cleaning of your facility and your materials, supplies, toys, all of that has to be cleaned on a regular basis. There may be some costs around staff training, and hopefully some of that you can get at no cost. There are capacity changes. I think Stephanie and Megan both talked about the fact that they had one capacity in March, and now that capacity has changed significantly. So you're not going to have as many children bringing in the same amount of revenue. So you have to look and see what that looks like. And then, of course, group size requirements are going to be changing. You can't have more than 10 children in a group, and that will also impact your costs. So now let me just go back. You now know how many children are going to be coming and when. You also know how many staff you will need because you've sort of plotted that out, looked at your hours of care and what kind of ratios you need. And now you also know what your new costs are going to be. The great thing is that some of the new costs will be covered by grants. So for example, yesterday it was announced that there will be $5,000 available through NJCCIS for all licensed centers. It doesn't matter whether you have subsidy children or not, all centers are eligible to receive that $5,000. You just have to go on NJCCIS to access those dollars. So next slide, please. So what I want to just talk a little bit about is you need to look at your budget to see whether how you support the new costs as I just outlined. Are there areas that you can cut costs? And in some aspects, you might have to increase rates if you're a private center. So you need to look at all those things. But I'm going to turn it over to Winifred now, and she's going to talk about financials and budgeting.
Thank you, Dr. Lynn. Sorry, I think the first thing me and my staff did when the governor announced the reopening of childcare centers was breathe. That is because we had been holding our breath for so long, and we got to a point where that seemed to be the next logical step. So I'm going to tell everyone to breathe. There are some great opportunities embedded in this time period. So you are working through the details of your reopening. Embrace the unknown, admit what you don't know, and work on improving the financial health of your organization, because this is a great opportunity to get real comfortable with knowing and understanding your numbers. Based on the new guidance, we know the number of students per class. You know how many classrooms you have, how many kids you can accept, and your fixed costs like mortgage, rent, insurance, utilities, benefit costs, and service contracts. You also know your administrative costs. You will need to figure out how many children are returning and when, how many rooms to reopen according to that number, and the number of staff needed based on state guidelines. One thought to keep in mind, if you serve children under 18 months, do you want to keep your group size at 10 or limit it to 8? If you limit it to 8, you will only need 2 staff. But if you keep the number of students at 10, you need 3 teachers. For every 3rd teacher needed, you could reopen 1 classroom. Some additional things to consider. How many non-instructional staff do you need to successfully operate and meet the new guidelines? How many people do you need to help with drop-off and pickup? If you change your hours of operation, can you reduce that number? How many cleaning people do you need? You might not be opening every classroom on day 1, so think closely about these numbers. The revenue generated based on the number of students coming back will help you to make some of these staffing decisions. Don't forget to budget additional dollars for cleaning and personal protective equipment. And it is a must to put aside money in the event an employee or child tests positive for COVID and an outside professional cleaning service is required. Just a few more things to keep in mind as you start to think about your financial health. If a child gets sick, do parents have to pay? If the center has to close due to a COVID positive child or an employee, do parents have to pay? If you're reopening June 15th and parents want to start back in September, do they have to pay anything to keep their spot? Are you enhancing your employee sick policy? If so, by how many days are you going to pay staff just in case they need to stay out if they're sick? This is a great opportunity to strengthen your tuition collection policy. Childcare spots are at a premium, so establish early that families can only return if they have a 0 balance, and do not let anyone get behind. Understand, the financial health of your organization is equally as important as the health and safety of your students and staff. Make policy decisions with that in mind, because you want to be here long after the pandemic is over. So give yourself permission to breathe, make mistakes, accept not knowing, use your licensing inspector as a coach. Advise all parents that things are fluid and may change. No one has done this before you, and remember, we're all in this together.